And once again, it's definitely a pleasure to be here with you this evening, 8 p.m. every Wednesday, at least almost every Wednesday. I know I miss a few, whether travel or sometimes, you get home and you fall asleep. Has that ever happened to you? But only once or twice has happened. But this evening, um, I want to get back into health and I want to talk to you about supplements. What are supplements? What are supplements? Well, many of us have very busy schedules. Grab a bite to eat here and there. We miss meals. Some persons actually live in some very inhospitable circumstances. They live in some countries where there's not a lot of food. They live in countries where there may be war zones. Or they live in countries where there's the abundance of one thing, but not an abundance of other things. There are people who drink a lot of alcohol, or they have fetishes, a sweet tooth, or some other thing that they like. And these things can certainly affect how they handle diets. But really, truly, a lot of us may need some form of supplement. And I want to go through this. But what are the supplements you know about? Well, I'm going to tell you about 5 categories of supplements. First of all, vitamins, and you've heard about these. We'll get into some detail, but vitamins is one of the supplements. The reason why vitamins are substances that our human body cannot make. And so, therefore, we have to take these special vitamins in with our food. And if it's not available in with our food, we have to take a supplement, something in addition to the food to supplement and strengthen the food, whether it's taken with the food or sometime later, one a day, twice a day, or the case might be. We have to take vitamin supplement. Then there are minerals. Do you know there are a number of minerals that you require? First of all, calcium. Calcium you require to build your bones. Do you know they tend to, in many years, they used to put calcium in milk. Calcium in milk as a supplement. They put calcium in many other type of powder, like wheat and so as to supplement it. Magnesium and iron, all these sometimes are taken as supplement. Iron in particular, we know building our red blood, iron is an important component of that. Right in the middle of your red blood hemoglobin is iron. And if you're deficient in it, boy, watch out. You are going to become anemic. You're going to have all kind of problems. And magnesium is also. These are some minerals. Then there are botanical herbs. Botanical herbs. Let me give you some example. Ginger is considered a supplement as a herb, And there are many other type of herbs that something called echinacea. These are herbs that you can take, whether for medicine or nutrition, and they'll be a supplement to your health and your diet because they will have some sort of effect. They're botanicals. But guess what? Some people have gone even further. They've extracted the active ingredients in that herb, such as caffeine. Caffeine is in coffee, but caffeine can be extracted and put into something else. Or have you heard of curcumin? Have you heard of curcumin? Curcumin is a very important substance in turmeric. And boy, it is powerful. It's anti-inflammatory, it is anti-pain, it's anti-cancer, Curcumin is great, and they have extracted the curcumin from turmeric, and some say having the extract being in a purified form is better than having it in the raw form inside the turmeric itself. That's interesting. And then there are amino acids. You know, protein, a lot of people go into health food store and they buy protein builders to build muscle and so forth. Kamal, you take those as well to build muscles and so. You don't do that? No? All right. We're not gonna recommend that to Kamal, you know? But guess what? The three big boys, the three big supplements around, you know what they are? Omega-3 fatty acid, fish oil, omega-3 fish oil, vitamin D, a big one, vitamin D, and the mineral magnesium. You know, these are some of the three essential, the biggest supplements that are around. Omega-3 fatty acid, right? Vitamin D, and magnesium. Now, let's get into some detail about vitamins. Do you know that there are 13 different types of vitamins? I know many of you have done this before, but I want to recap. We all know, and you've heard about them. There are two sets. There are some vitamins that can actually dissolve in water. And there are some vitamins that are only present in fat. They won't dissolve in water. They'd only be in fatty type foods. And the ones that are in fatty type foods are vitamin A, D, E, and K, ADEK. Vitamin A, D, E, and K. And the two vitamins that can dissolve in water are vitamin B, the vitamin Bs, there's a number of them, and vitamin C. Now, there are a number of vitamin Bs, let me tell you that. Oh boy. They call them B1, B2, B4, B this, B that. The reason why they jump around so is that there were some substances that were once considered to be vitamins. And when I went to medical school, a couple of things were considered vitamins. Then guess what? Biotechnology found out that our bodies actually produce a very small amount of these substances. And what's the definition of a vitamin? Something that the body cannot produce, never produces. If the body produces it and can produce even small quantities, it's no longer a vitamin. A vitamin you must take inside food or as a supplement, a tablet, as injection or something like that. So, question is, two of the important vitamins I want to tell you about is vitamin D and vitamin B12. Again, when I went to medical school, I learned that Black people have no problems at all with vitamin D. And that our skin is a vitamin D reservoir because of our Black skin, right? That we have no problems producing vitamin D. Well, we've since found out a number of years ago that actually it's the opposite, and that Black persons can be very vulnerable to being low in their vitamin D. The reason why is that the melanin in our skin tends to shield the sun from reaching some of the tissue below that melanin layer to generate vitamin D. Let me go that again. Do you know vitamin D can be made in our skin? Yeah. You could take it as a supplement, as a tablet, and it's in liver and in certain, but our bodies can actually produce it. All you need to go out into the sunlight, right? You just need to go out in the sun. And the sun, when it hits your skin, it's going to penetrate and go deep, the ultraviolet light, and will generate vitamin D, certain forms of early forms of vitamin D that will then be converted to full vitamin D in your body. But you know what? Today, there are a lot of people who are hardly outside. They are in air conditioned conditions from the morning to the evening until they go home when it's dark and the sun is down. In other words, the amount of sunlight they're exposed to, they may be exposed to some early in the morning on their way to work, but and maybe exposed to a little bit in the late evening, 5 o'clock when the sun is going down. But most of the day, they're indoors. They're not getting any sun. Okay, they might go out for some lunch, you know. But if you live in a country like England or even in the United States or Canada, you work in air conditioning, or suppose you're an elderly person in a nursing home, or suppose you're bedridden and you don't go out as much. You have an injury to your legs, you don't walk as much. You can be indoors, not getting enough sun. And therefore, you could become vitamin D deficient. And we've been finding there were studies done in Colombia, studies done in the southern United States, and found a lot of black people, a high percentage of them, were actually vitamin D deficient when they didn't know about it in the first place. There's been a big fight over this, whether it has, some truth to it or something, but it's rare. And if you are out in the sun, you're a farmer, and so you don't have to worry. You know what I mean? If you Kamal, you're a person, sometimes you're in studios a lot and so forth, you know. Yes. But Kamal, I've asked Kamal, but I'm not sure he gets enough. You know?
You're not sure I get enough?
If he's in a car, if it's a car, you ain't getting no sun. If you're on a bike, you know,
Too much.
you might get plenty in a bike. Kamal, well, let me take that back. Kamal's okay. Kamal's okay. Now, vitamin B12, on the other hand, we get vitamin B12 from meat, from a number of other substances. I'll get into some detail, but you can also be very deficient in vitamin B12. The great thing, is that you can take vitamin D and vitamin B12 together safely, as they serve these different essential functions in your body, and combining these vitamins can support your whole body energy production, your bone health, and your overall well-being. And so I want to, vitamin B12, most humans get from meat or seafood or dairy products. And it's essential for red blood cells production. It's essential for your bone marrow to start moving and get going. B12, bone marrow. And I remember when I practiced in the United States, I used to have to give people injections of B12 to help boost that bone marrow red blood cell production. Now, it's not only B12, other things have to do that too. B12 is also important for your cells to grow and to produce. When B12 is low, the tissues in your body that have to multiply fast slow down. And boy, that has to be really consequences. And B12 also supports the nervous system. And people who have B12 deficiencies have all sorts of nervous health issues, right? Nerve health issues. And, we will have to look at that very carefully. Now, going back, I was mentioning about vitamin D. But the important thing is that vitamin D and vitamin B12 are very important. Now, I I've already said that you may not need supplements really if you eat properly and have a good food plan, you know? And it's good to eat healthy, but food can be expensive. Sometimes food can be short. Sometimes there are people who just live on potato chips, right? They love that. Or people just live on peanuts or live on this or whatever, you know, or people who love ice cream or chocolate cake or all sorts of things, or people who drink rum, a lot of rum, right? Now, so eating a variety of healthy foods is the best way to meet all your health needs. But if you are low in certain type of things, vitamins or minerals, or just want to cover your bases, then you can take a multivitamin. You're going to know that multivitamins may have a number of different vitamins in them, and that's okay. That's okay. Taking them all at once in one tablet as a multivitamin on a regular basis is a good strategy. You know, I've gone to some places and people have 15 different bottles in their cabinet. One of this, one of that, one of that. Tell you the truth, there's nothing wrong with that. There's nothing wrong with that. But remember I said there's water-soluble vitamins and there is fat-soluble vitamins. The water-soluble vitamins mean you can't store them in your body. When you take them, what's used is used. What air used is passed out in your stool. Now, the fat-soluble vitamin, if you take too much vitamin D, if you're obsessed and you're taking a ton of vitamin D or a ton of vitamin K or vitamin, these things, vitamin A. If you take a ton of vitamin A and a ton of vitamin D because you want to make sure you don't have no deficiencies, so you stock up taking 2-3 tablets a day, you could run into serious problems. Iron, if you take too much iron, there are people whose liver could get affected by taking too much iron. We have an early call, you mean? A question, yes. Question. Would you recommend traditional supplements, either Grandmother Bush recipe instead of the official tablet version? And why are they not encouraged to be used more? Well, let me come to that. Let me not pause on that question. I'm coming to it. I wasn't going to leave that out. I'm going to deal with that. But let me just go through this first. I'll come right back to that question. Great question. You heard that question? Why don't we go to Grandmother's Bush recipes? Well, let me tell you, first of all, it ain't Grandmother's Bush recipes. It is also today's recipes. It's today's supplements. Many of them are still being used and still in effect. But you're right that some of them have been lost because grandmothers have not necessarily been able to pass it on to others, or persons haven't picked it up because they feel there's modern medicine is better. Now, so I want to encourage people to eat properly. And that the idea of supplements is more when there is a deficiency to fill the gap, to fill the holes, to fill what is not being taken because you're under stress, because you live in a place that don't have certain foods, or place don't have enough food, or there's a shortage of food, whatever the case might be. It is important that some people take supplements, but having a diet is even more important. Being on the right diet is more. Now, when do you take water-soluble vitamins? Let me say, water dissolves them, and your body, as I said, can't store them. So most must be taken every day. You hear that? Have a call? Okay, I didn't answer that last question, but let's take this call too. Hello, good evening.
Good evening, Doc. How you doing?
Not too bad at all.
Well, I'm a man of intention who likes to broaden my scope when it comes to knowledge, be it in medicine, be it in history, be it in everything.
Yes.
I ain't one of those dummy Vincentians who just sit down and listen.
They're not
And
a
let-
lot of dummy. Most Vincentians are very smart, Dave. I know that. You're right.
So anyhow, I just start like that because sometimes I listen to certain people say what they have to say and nobody question them about
Sure,
anything.
sure,
Like when I
sure.
was in the hospital, people, patients, well, I guess because of my outspokenness, they hear me talking to the nurses, asking questions. That they would tell me certain complaints that they're having or certain things that are on their mind, and they would like me to ask the question for them. So I say that because that was part of my, well, not duty, but I help a lot of people. Patients, I'm talking about, hospitalized, suffering from whatever they're suffering from,
Yeah.
to convey or to ask questions on their behalf. Anyhow, some time ago, I asked you a question, I don't know if you recall, in terms of um, practicing euthanasia in this country.
Okay.
And I would like to get an answer to that from your perspective. I know a lot of moral issues may come up with that, but I remember I became curious about it when there was a black guy and a white woman in England, where you would have studied and where you may have some knowledge of that too. When they first decided, that couple, white and black, to end their lives and so on. I mean, you can pick up from there. The other thing is, I noticed I've been the victim of something you call, I hear different names. Losing your skin texture, and getting some kind of, different color to your skin. I know of one or two people who suffered from that. There was that Indian man. He was the first one I saw. His whole body changed. I don't know if he's dead or alive. So anyway, he's a small place, but I mentioned that, and since brings me back to those days because I learned that quite a few young people are having that problem. I have become a victim of that. I notice, not to any large extent, but once it appears, I think it's going to continue. So I forget the name. It has a very strange name, which up to now I haven't learned properly to pronounce. I won't attempt to call the name. So I hope you have an idea of the question I asked about euthanasia and this change in your skin color.
Yeah.
And I can't remember the name of that thing. So
Yeah.
I will listen to your response
Sure.
if you can
Sure.
provide me
Sure.
with any information. Thank you.
Yes. Okay. No problem at all. Yeah. Dave, let me say thank you for your question. I am an individual who is quite opposed to euthanasia. I am aware of a number of circumstances where people have committed euthanasia. Matter of fact, you're right. You're right. There are many stories. I'm not sure if it's the same one of a British man and his wife, neither of who actually had terminal illnesses. One had epilepsy. The other one was a diabetic, but those are not terminal illnesses. and they went to a special Swiss euthanasia clinic in Switzerland where euthanasia is allowed, and they were able to conduct euthanasia and die in their own accord. I suppose I've been trained to do every single thing to keep life going. And it is true, sometimes you have very elderly person who maybe have Alzheimer's and so forth and things like that. And somebody said, "Nah, let them go. Let them go." I've always been a little bit more inclined to want them to stay that little longer. Sometimes let them stay longer, they become vegetable or vegetative. They can't talk, they can't eat, they have to be supported in some way, whether with a machine to help them breathe or a tube in their stomach. And so I understand, but I have never understood that line, that red line that one needs to cross to do it, because I feel that line is so broad that sometimes you will make a mistake, or that a person who wants to commit euthanasia may be doing it because they think they're going to die, or because they're depressed, or because they have something wrong that can be treated that then can pull them back. So I have seen many of these cases, or I've seen not many, a few of these cases where I believe that people give up and they think they're ready to go because they have no hope. And in my view, I think that in a couple of cases I've seen, they were mistaken. There was hope. There was hope. I've seen people being pulled back from the brink. In the early days of AIDS, there were people who wanted to commit suicide on hearing they had AIDS. Today, people are living absolutely like normal life. All they have to do is consider safe sex, but their viral load is undetectable. And that's amazing. We used to think it was a death sentence, and the amount of people who committed suicide. I had patients, AIDS patients, who committed suicide because they were ashamed or because they just couldn't face it. And it's something that's unfortunate. I don't quite agree with euthanasia in that regard. And now let me say, in relation to your other question, diabetes belongs to a group of illnesses. I'm sure persons may have heard of lupus, and you may have heard of other forms of arthritis. Well, you know, a lot of these conditions, I could prattle off a number of them, they have an inflammatory condition that can affect the joints, or the inflammatory condition can affect the bowels, or the inflammatory condition can affect the liver, or the inflammatory condition can affect the skin. And in a number of these conditions, there can be what I call antibodies that the body produces against the skin. And you could see little patches, and the word is called vitiligo. The vitiligo. And they start to lose the pigment in the skin because the same melanin I was telling you about is attacked. Remember I tell you about the vitamin D that is produced below your melanin layer? Well, if the melanin in a patchy way is attacked, you will start to have these spots. You start looking a little, I could use the word, a little polka dot. You know what I mean? Michael Jackson had vitiligo, right? And there are ways in which we try to reverse it by injections, using some different type of things. Let me use the word. We could use some cortisone, some steroids to reduce the level of inflammation and so. And it works sometimes, it doesn't work sometimes. But the people who really have it bad, vitiligo, is because certain things, there's an inflammatory process actually attacking the skin. And it's part of a diabetic profile. It's part of a lupus. It's part of arthritis, or the many different type of arthritis condition. So, you know, thank you for the question there. And now, I was saying that vitamins, right? Some are water soluble, and most of them can be taken on a full stomach. By being water soluble, your body can't store it. What does that mean? It means you have to take these vitamins on a daily basis. When you take one, it isn't being absorbed and stored in your liver or your muscle or anything like that. You know what I mean? It's being passed out if you haven't used it. So that the next day, if you don't take any, you won't have any. If for the next month you don't take any at all, you won't have any unless it's coming in your food. So if you have to have a supplement, you got to take them on a daily basis. Now, the only vitamin that you should not take on an empty stomach is vitamin B12. Taking it with food helps. Now, vitamin B12, I want to add this, you should not take it with vitamin C. Vitamin C tends to prevent some of the absorption of B12. You see how all these things go? And it's really important to know some of these things. So you could take these vitamin B and vitamin C on a full or empty stomach, but vitamin B12, you should take it on a full stomach. Take it with food, B12. And additionally, if you're taking vitamin C at the same time, delay the vitamin C for a couple of hours. Take it about 2 hours later. Don't take it with the vitamin B12. That's what you got to remember. Now, what about iron? Iron, you best absorb iron on an empty stomach. Empty stomach. Take it with water. Or better, take it with some orange juice, citrus, lime juice, lemonade. You know, I'm not talking about lemonade, you know, the fizzy beverage lemonade. I'm talking about a lime you cut and squeeze it in, that kind of lemonade. You know what I mean? Or orange juice. Take it with some orange juice. And here, iron and vitamin C go together. Iron, vitamin C. Iron, vitamin C. They're a tag team. Remember I just said, don't take vitamin C with B12, but with iron, take vitamin C. They're a tag team, and they help your iron to be absorbed if you have some good amounts of vitamin C around. That's why we say the citrus and so forth. All these things are good, you know? Now, I want to say that in terms of minerals, large doses of minerals can sometimes compete with each other. And I see these people, they got this mineral, and taking one of this, one of that, one of the other. As a matter of fact, they say, for extra, let me take 3 of this, 3 of that, 3 of that. You know what I mean? And sometimes these minerals can compete with each other. Now, don't use calcium, zinc, and magnesium at the same time. Kamal, you ever taken a zinc supplement? Have you ever taken a magnesium supplement? Have you ever taken a calcium supplement? No. And many of you are wondering, what the hell am I talking about? Who's taking magnesium supplement? Who's taking a zinc supplement? Well, I'll tell you, a lot of people, especially magnesium. But I want to say this carefully. This program is not recommending that you go out and start to throw down magnesium because you hear other people throw down magnesium. You know? But these 3 minerals are easier on your tummy when you take them with food. So it's good to take them with food. So if your doctor recommends them, have them at different meals or snacks. So you take with food, but take one with breakfast. Take one with lunch. Take one with dinner. But don't take them all 3 at the same time, but you got to take it with food. So, you know, you split it up. Nobody remembers that. Now, don't take an individual mineral at the same time as a multivitamin. Does that sound strange? Right? Or an antioxidant vitamin. Antioxidant vitamin means vitamin C and so forth, vitamin E. Like, and these are important things. Now, if you take vitamin A, watch out for the amount that you take. Remember I said vitamin A and vitamin K and vitamin D are stored in your fatty stuff and so forth. So you could become overdose. You could take too much, right? If you're pregnant, doses under 10,000 micrograms a day is what's recommended. I've said that because I think it's important to say, right? And let me say, a substance that the body converts to vitamin A, we call beta carotene, may raise your chances of having lung cancer if you're a smoker. This is an important study. Imagine that. If you are a smoker, then this important substance can increase the risk for lung cancer. You're the solution? Don't smoke. Don't smoke. That is what I really want to say. Now, I could talk a lot more, but that earlier question is there hanging. And I want to say that there are some very important supplements that are herbal in nature. We know St. John's wort is a supplement that often taken for depression and anxiety. We have our own version of St. John's wort, and it helps with sleep problems. There's something called kava. We don't have it around much here, but it's really important. This is a supplement also to help with anxiety and insomnia. People can't sleep, but it may cause sometimes some other problems, like some liver problems and so forth. Then you've heard of ginkgo. All these things are more commonly used in other countries. But let me now start getting to some ginger. People take this to try to ease nausea brought on by all sorts of things, no surgery, chemotherapy, pregnancy, or anything like that. And sometimes it's used even to help treat arthritis pains and other joint pains. Ginger can have some few little problems, but ginger is good. So you got to check with your doctor. And it's something I often recommend. Aloe, rubbing aloe. Rubbing this plant on burns or on different skin condition. And, it's the usual way which we take it. But some people take the aloe by mouth. Matter of fact, it's a whole set of products. Come on, you take the aloes by mouth? Huh? Yes. And, not a lot of problems with this. Some people say, doesn't have any taste. Yeah, but it can lower your blood sugar levels. And if you're diabetic, you got to go look at that. There are a host of other things. We have a local ginseng. Everybody know, but ginseng, some people take this because they hope it may slow aging. Others take it for diabetes, boost immunity, and also help with sex. But it can also drop your blood sugar a little bit, and so which may be a good thing or a bad thing, And there are a host of things. Let me give another one. Garlic. Some people believe it helps with high blood pressure and can treat cold symptoms. Studies show that it can lower your blood cholesterol level a bit too, you know. Yeah, and it's safe for most people. But garlic can also thin your blood a little bit, you know. And so if you are on blood thinners already, then garlic, you know, we got to watch to see you haven't overdone it, because that could increase your risk of bleeding. But garlic is great. I'm saying this because I think that kola, let me call you licorice root. We don't have licorice so much down here. A couple of people have it, but these are really great stuff for respiratory illnesses. And I could go on and on and on. It's like stinging nettle. Let me see, stinging nettle. This is thought to help with allergies and arthritis. There's some evidence that stinging nettle, along with certain other substances, can help with the prostate, the swollen prostate, and things like that. Some people use it on the scalp, stinging nettle on the scalp to fight dandruff. But boy, if you're gonna have stinging nettle on your head, you put stinging nettle on your scalp. That's interesting. That's interesting. That's adventurous. But nettle can make your body hold water. What I'm getting at, I could go down a long list, and some people may have thought I would get into body me eye and part of man life and seed on the leaf and so. There are certain herbal things that are used for medicinal treatments. Now, on the other hand, a supplement is something that you're supplementing what's missing from your food. So if you have a health condition that may require a herbal remedy, then that's good. That's not a supplement, that's a treatment, right? But a supplement that I was talking about, and the question really was traditional supplements. I would have said traditional medicines and traditional medicinal compounds to treat specific illnesses. And when that illness is over, you stop taking it. I want to say that again. Medicines. If you have an infection and you take antibiotics for it, you don't take antibiotics for the next year. You only take antibiotics for those 7-10 days that the doctor says to take it for, because then by that time the infection should be over and you don't need to take anymore. That's treatment. A supplement may be something you're supplementing. So when I said vitamin B, I said you got to take one almost every day. I didn't say you take one every day for 7 days and then stop, you know, or you take one for 14 days and then call the doctor. You know what? Supplements, really, if you're not getting it from your diet, you basically may need some supplements. And when you take supplements, don't go overboard. I'm telling you something. Iron. People who consume huge amounts of iron, not only will you get constipated because the iron will make your stool get hard, but the iron gets into your blood and it makes good amount of blood, but the excess iron starts to get deposited in your liver, in certain other tissues of your body. And the people who have been taking huge amounts of iron for 10, 15 years now, taking some additional iron for 3-4 weeks, you know, bumping up the iron for 2, 3, 4 months. It's not going to be a big deal. You understand? It is when you're taking the iron as a supplement, right? For years, that can cause problem. Let me say that again. When you've been taking excess iron, let's say you're supposed to take 1 tablet of iron a day, but you've been taking 6 or 10 for good measure, those excess amounts are being deposited somewhere, usually in your liver. And your liver actually becomes virtually like iron, you know? And you can have some serious problems where your liver starts to fail, your kidneys, all that kind of thing. So supplements are good, are great, but be quite careful in relation to that. Now, on the other hand, medicinal plants, like ordinary medicines, should be used sparingly and specifically. You understand? Used specifically to treat a particular type of illness that they recommend, and you should assess, well, is it really working? You know? Is it really working? And taking it in the raw form, is it better to take turmeric in its raw form, or is it better to take curcumin, which is the active ingredients in the turmeric?
Doc, I have a question.
Yeah.
What it really is. So, as the person who wrote traditional supplement, and as you say, it's more like medicine. What about the tea, the bush tea, and what would you consider them to be?
Well, there are many different types of bush teas. And
Are they supplementing anything, or they're more along the medicinal line?
well, some of the bush teas may have in some nice substances in it. Green tea having antioxidants in them. They can have something called polyphenols. These are some important substances that we found can help to reduce your inner body stress. I'm not talking about stress in your mind, you know, the body stress. And how can I put this over? You're in a car and you know there's something called a muffler that comes out of the car. And you know what comes out of the muffler is some smoke and some toxic chemicals that have been burned in the engine. But the engine is making the car move nicely and smoothly. But there's some byproducts that come out. In your body is working nice and smoothly, but there's some byproducts. First of all, what comes out in your stool is products that haven't been used. You've been eating too much. If you sit down and eat a whole bowl of Lay's chips, right? Or you just eating one thing alone, you can find some funny stuff start coming out of your stool. Your stool will start looking yellow, stringy, and all that. Or what else? You can pee out some of this stuff, and you notice the different colors in your pee sometimes. Clear. Be very careful if it's ever red. That's blood. But it could look dark and so forth. That means some things. But do you realize that some stuff is actually building up in your body, and your liver is the big filter, the big detoxifier? It's taking chemicals and breaking them down into simpler substances that are not harmful. Now, these substances that are harmful, they're still around, some of them, in small, maybe larger amounts. By taking certain foods that contain polyphenols, that contain antioxidants, you're helping to mop up those things that the liver hasn't taken care of. You're mopping them up. You're taking them. It's like Pac-Man. You're sniping. You're sniping at some of these toxic stuff and destroying them, because if they build up in your body, they could affect your skin. They could affect your heart. They could start to induce all kind of fatigue, and so they could start to affect your brain. They could do all kind of things. I could start telling you how some of these substances can wreck you over a period of time. So, Kamal, your question, taking certain type of, but which type of tea? There's something called the Guyanese bush tea. It's a famous question that comes in board exams. I had it in my board examinations, and so I got it right, I'm sure. Because this Guyanese bush tea is notorious for inflaming your pancreas. It's a form of pancreatitis. The Guyanese bush tea. It's a form of tea that tastes good. That somebody decided that they're going to make a tea out of boil it and drink it. Maybe add some sugar to it and thinking but boy, it causes an inflammation in your pancreas that is difficult to recover. Pancreatitis, you get so much pain. Your pancreas becomes inflamed. It's a kind of a pain that is in the front of your belly, but also in the back of your belly as well, in your back. And people can die from these things, right? So I want persons to be very careful and to understand that not all bush is good, because there can be some good substances in it, but also some bad substance. There sometimes at the age of the fruit or the leaf, the good substance only comes out at the end, or the good substance is there early and it changes to a bad substance later. Consider ackee. If you pick ackee too early and try to cook it, crap or smoke your pipe. You understand? And you can have some of the most severe vomiting that you will experience. Yeah? They call it Jamaican vomiting sickness, they call it. But if you allow the ackee to ripe and to mature properly, then there's no problems, because the substance that was going to cause the Jamaican vomiting sickness is no longer there as weight. So I want everybody to be careful. Don't subject yourself, somebody saying, this is good tea, good bush tea. You know what I mean? Good bush tea is something, find out a little more about it. Ladies and gentlemen, nice questions. We're at the end of the program, and I want to thank you very much. You said, the question says, sorry, I missed the reference to the prostate issue. I was saying that this is all about stinging nettle, but I'll talk about this at some other time as we edit the program. Ladies and gentlemen, it's wonderful, always nice being with you. Good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in